Hello. Um, what we're doing here today is an instructional video on how to use the Naloxone overdose response kit. Every Naloxone kit comes standard with 3 vials of Naloxone, 3 Vanish Point needles, breathing assistance, one-way check valve, gloves, an instruction pamphlet, and some alcohol swabs, and some little details on what to do if you have to leave somebody that's overdosing to go make a call to the ambulance, for example. And basically all it says is to check the breathing and put them in the recovery position. I'm not going to get into the first aid side of things because we're here doing a demonstration for the Naloxone, so let's just keep it simple. These were where I got stuck the first time. So this is a little glass vial. It has this little plastic protector on side, and the glass is scored on one side. So if you try to break this and it doesn't break, it's just as simple as just turning it a little bit in the opposite direction and trying again. It should break with almost no effort. Okay, so let's try to break this. Okay, it's not breaking, and then turn a little bit. There we go. So give it a couple of little half turns and found the score, and it broke. Don't try to force it. It is glass. It will break in a way you don't want it to. So just turn it until it breaks lightly. So you put the needle into the bottom of the Naloxone. Do not push this down. This is a Vanish Point needle. This part that's sticking up is how much it needs to not pull the needle back in. If you plunge this down, the needle comes up and in, then you have no needle. So you draw the entire contents of this little glass container into your syringe, which is 1 ml. Notice I got some air in here. Turn this upside down. Squeeze the air out. A little bit of air will not hurt somebody. Intermuscular, even in the vein, it would take a lot of air to do any damage to anybody, so don't worry if you have a tiny little bit of air in here. You want to find somewhere on the body that is got a lot of flesh. You don't want to get in any veins. You don't want to get in anywhere sensitive. Straight up into the butt or the thigh or the shoulder, wherever there's a lot of muscle and meat. Okay, so you whack the needle straight in, bam, right to the bottom, and don't be gentle. You just pump that right in there. And then when it's fully gone, notice there's no more needle. It shot back into this container here for your protection. That's why it's called a Vanish Point. Now the dose has been administered. Keep an eye on breathing. You will be on the phone with somebody who is the 911 responder, and they will keep a timer. They will tell you what to do, and they will tell you when to administer your next dose, which is approximately every 5 minutes until they recover. If you do not have the 911 person on the phone, you have to time it yourself for 5 minutes. So you give your first dose. Okay, you make sure that they're breathing. They're in the recovery position. If their breathing is effective and you don't have to give assisted breaths, then proceed to ready your next needle. Take it out, draw the needle full of the dose, put it aside somewhere safe where nobody's going to bump into it or drop it on the floor or anything like that. And it's quick and ready to use when you hit your timer or when the person on the phone tells you that it's time to administer another dose, and then you repeat that process until either the ambulance arrives or that your patient has recovered, etc. And that is how you administer Naloxone with the Vanish Point needles and the standard issue Naloxone overdose kits. You can also you can get nasal Naloxone, which is very easy. It's just a sprayer that you just pop up the nose, but they're very, very expensive, so they don't hand them out standard issue to health stations. You have to get them with your status card when you go to the pharmacy. They don't ask questions. They just give them to you because they're covered under your First Nations coverage, INAC or whatever. Okay, so thank you very much for watching this video. This is an instructional video on how to use naloxone overdose kit. Thank you from Anspire Health Services. Have a good day and stay safe out there, folks.